Missouri's oldest social services agencies is stepping up as the need for accessible mental health care increases. Lutheran Family and Children's Services is now offering free mental health services for qualified children and adults in Jefferson County. And joining us this morning to talk about the need for these services and how you can benefit is therapist Adelie Chafee. Thank you so much for joining us this morning.
Thank you so much for having us. We're so excited to be able to provide free services for people because the need is definitely increasing.
And we want to make sure people know about it, which is why we're so glad y'all came on. So first off, before we talk about the need, just tell us a little bit about Lutheran Family and Children's Services. You know, what is y'all's mission? How long have y'all been around? I know you've only been there a year, but just talk about the mission as a whole.
Yeah, so we've been around for a long time, about 150 years.
Wow.
So we don't plan on going anywhere. We're really dedicated to helping children, teenagers, and families, and now adults in Jefferson County navigate all life stressors, and there's just a lot out there, so we're happy we're here.
And we were talking earlier about this growing demand. Why do you think, as a therapist that you've been now for 3 years, there is such a growing demand across our area for mental health care?
There's a lot of tough stuff going on. Our economy is hard, you know, finances, COVID happened, and that threw a wrench in a lot of things, and emotional regulation, things are just hard, you know.
When did y'all start to notice that there was such a gap in Jefferson County? I actually did a story last year when there was finally a behavioral health center there. It was the first ever. Why do we think there's been such a gap in that area specifically?
I think St. Louis gets a lot of attention just because they're bigger, but Jefferson County, you know, it's a big county. There's a lot of people out there that need the help, and I think just they increase the borders and the range.
And I think, you know, a lot of times, depending on where you live, people may not talk as much about mental health care, the importance of it, right?
Yes.
So having those conversations. How is this program, offering free services is huge. How is this all made possible?
So we have very generous donors. We're very, very pleased with them. They understand the need, and it's the Jefferson Foundation and the Jefferson County Community Mental Health Funding Board that make it possible for free services.
And why is that free element so important? Why is this so much bigger and y'all are going to be able to reach so much more people?
Right. It's already stressful to ask for help. It can be very intimidating. So we want to make it as easy as possible, not have anyone jump through any hoops, and just get help, you know, not have to worry about the financial aspect of it.
And, you know, in terms of kids, when do we start seeing, which I think is great, more kids seeking this out, more parents seeking this out for their children? Do you know when this kind of started to be a trend since you've been in the business? Has it been this way?
Yeah, I think it's increased. I think people are understanding more and more the importance of mental health, and the ages are getting younger and younger, with just hard to deal with emotions and just helping those kids navigate it sooner rather than later.
Do you think that with more kids needing this, that social media has really made an impact? Is that what you're hearing? Because we were talking earlier and you were like, you get so connected to these kids, it's heartbreaking to hear what they're going through. Do you think social media is a big factor? Because I could not be a kid right now.
Yes, it's
right?
a huge factor.
Yeah.
It's a huge factor. People are diagnosing themselves. There's so many different things online that they're getting exposed to, and it's hard to navigate, especially having a young mind and trying to figure out what's going on out there.
Are you seeing more like young boys or young girls, or is it a mixture?
It's a mixture, and it just keeps getting younger, and you know, I'm just glad that people are taking it more seriously. It seems like people are taking it more seriously.
So it's children and adults that can get these services. How can people reach out to you for it?
So we have a phone number,
Okay.
and that phone number is 866-326-5327. You can email us at help@lfcs.org, and we also have a website, which is lfcsmo.org, which we have all our information on there, and you can fill out a form and get a hold of us.
Are there certain qualifications people have to meet to get this free care?
No, we take everyone. In Jefferson County, we're really happy because we can take the adults now. In
Okay.
other places, it's just kids
Okay.
until they turn 18. But in Jefferson County, we take adults now. So everyone qualifies. We try to take everyone we can.
That's awesome. And how have you seen in your time as a therapist how really proper mental health care can change people's lives? What have you seen in people like that you talk to?
Yeah, it's so great because I see all kinds of things. There's so many different changes and struggles that people have, and you just get to watch them grow and see how the things we talk about in session, you know, manifest out in the school world or their home life, and it's a nice thing to see.
And what is your message to parents who may, some people still don't really agree with going to therapy. So what's your message to parents this morning if they have a kid that's struggling? What's your push?
Yeah, there's nothing to lose here, especially with Lutheran Family, having the free services, and there's really nothing to lose. You never know what you could learn, when you reach out and ask for help. We're here to help and we want to help, so don't hesitate.
Yeah, thank you so much, and
Yeah.
thank you guys for offering these free services. It's really going to make a difference. We appreciate it.
Of course, thank you for having us.
Of course.